So we are going to talk about the mental health tsunami. And what I want to focus on today is a couple of things. One, I want to talk about the tsunami, what it actually is. And I'm going to share some data and insights from top employers and health insurance companies about what is their approach to this problem and the methods that they're using to make a big impact. And as harrowing as this picture looks, this is going to be a good news story today, right? We have seen that with any sort of crisis, advanced warning and preparation can help you weather the storm great. And while for all of us, we're experiencing this increased level of anxiety and this high stress and delayed chronic condition support, there are all these things that are triggering some pretty significant healthcare costs that are damaging the economy in different ways. And so what we're going to look at today are some of the data and insights that we're going to make an impact here. A little bit of context on how we came up with this data and who we are. eMindful has been around since 2007. We are delivering live, virtual, evidence-based mindfulness programs to a number of large corporate and government clients, and doing so to help people with those everyday moments, but also those chronic conditions in a way to help them make every moment matter. And the data you're going to see today covers roughly 8.6 million eligible lives across a large number of employers. So whether they're coming to our app or they've embedded it into their own experience, this is where all the data is coming from. And when we measure data, we're using third-party validated instruments. So we're not coming up with our own proprietary scores. It's a little bit more than just, hey, I feel great right now. It is using standard scales like the Perceived Stress Scale, the Work Limitations Questionnaire, the Pittsburgh Sleep Quality Index, biometric data when our partners want to share it with us, but all to deliver those gold standards, right? The randomized control trials that you can publish in peer-reviewed medical journals, which we've done a few of those. So let's take a quick look at one just interesting quick stat about just this year. We've all experienced this increased stress together this year, right? And what we're looking at here is a measurement of the Perceived Stress Scale. And we've looked at it over time just this year in about 15,000 participants. And what we have found is that people who were practicing mindfulness before the pandemic have actually been more resilient once that pandemic showed up. If you look at that teal line above, you can see that people have gravitated toward it, they've come to it, but they are still experiencing that higher stress. So what we're seeing is that the skills of mindfulness work to help you better cope. Fortunately, we've also seen that the more you practice, the better you get. This is a skill that can be developed. If you look at one end here, you can see that those who are new to mindfulness have a very narrow range of high stress. But the more you practice, the more you become dedicated to practicing, you're going to see a wider range, but all lower stress. So really good to see that this is a muscle, a skill that can be developed. And what's encouraging, I think, for all of us in wellness and well-being is that we are seeing a greater shift of people's acceptance and approach to this, right? Where before COVID, we saw roughly 60% of our participants were new to mindfulness, new or had just practiced a few times. What we're seeing today is 80%. 80% are new, and that's showing us that all these new people have said, we've got a mental health issue, we need to do something about it. And so they're coming in, they're seeking help, which is great. But that's just a little bit on the surface, right? And we really want to go deeper. And one of the most compelling things for me to participate in the Global Wellness Summit, and this is my second time coming and I absolutely love it, is to see these two different perspectives, right? On the one side, we've got wellness, well-being, tourism, real estate, and then we've got employee wellness on another side. And both sides seem to be having this conversation, same conversation, but they are two different epicenters, all serving this greater idea of resetting the world of wellness. It's a shared perspective, but the languages are so different. Maybe they're not different languages, maybe they're different dialects. But I see an enormous opportunity to help each other bridge that, translate, come up with a translation tool for these two different dialects in a way that we can move toward resetting the world with wellness collaboratively and not competitively. And let's look at some of how these next few slides will share one translation tool around the ROI. So what put us on the map, eMindful on the map, was Mark Bertolini. He's the former CEO of Aetna, and he talks about his story quite publicly, and he was in a major ski accident. Terrible injury, he was airlifted off the mountain, almost died, almost paralyzed for life. And in that recovery process, he was in an opioid fog, severely depressed, and not getting well. And it wasn't until he found yoga and mindfulness that he set on his true path to healing. And so then he said, this is great, this is the way. How can I bring this to healthcare? He found us. And together we did a randomized control trial with Duke Integrative Medicine and Aetna, and we published the results of that, pretty significant results, in a peer-reviewed medical journal. And then he gave it to his 50,000 employees in the book of business after that. This is one of my favorite data slides, because when we are stressed, we're not that productive, right? And we all feel that intuitively, but this is what this data shows, is a correlation measured over 10 years to demonstrate that roughly 20% of your stress, 20% of your productivity is attributable to your stress. And we measure this with the perceived stress scale and the work limitations questionnaire, another study developed out of Tufts University. And so for every point we reduce of stress, you gain 7 minutes of focused performance. We've also seen that 1 point of stress correlates to $96 per year in claims cost. And as we've measured our programs over time, roughly 74% of our participants are improving their stress by 7 points, an average of 7 points. So when you look at that ROI, 7 points times $96, that's roughly per participant $700 per year in improved healthcare savings. That's tangible hard dollars. Then you have a little bit of this softer cost, which is the productivity side, right? That's salary, the idea of your mind wanders every once in a while. 7 minutes times 7 points, that's 49 minutes per week, 42 hours per year. You take those 42 hours and multiply it by an average salary, and then you get a very significant ROI for our employers and health plans, the payers, who are sponsoring these employee benefits for their populations. So when you think about how to have these conversations around wellness, the ROI, you heard earlier this morning, the investors, when they talked about the numbers they want to see, when they want to talk about how to grow and scale businesses, that's some of the dialogue that they're having and what you need to show, that accountability and performance to measure success and achieve those outcomes. So how are they doing some of this? One thing that we've identified that has been very effective is the application of mindfulness, how to make it practical, relevant, and stigma-free. Where it's not you're going to seek mental health support because you've got a disease. Most people think, hey, you know what, I'm feeling pretty okay. And they're not thinking that they have a problem. They might not be aware that there's added level of stress that's impacting their performance. And if you teach somebody awareness of breath, body scan, that's great, but what do they do with that? How do they handle the everyday stressors that they're experiencing? And so what we've started to do is really apply mindfulness to those everyday moments, right? How do you handle an overwhelming to-do list? What do you do about financial stress? Are you having difficulty sleeping at home? Do you have a sense of missing connection and social purpose in your life? All of those stress triggers that show up, we help people with skills to make those moments matter. And when we think about who we compete with, we're not competing with a Headspace or a Calm or anything like that. We compete with Netflix and Facebook and social media and the 24 news cycle and all of the things that compete for your finite, precious resource of time. And so what are people Googling about right now? They're Googling about things that they care about in the moment. And so as you think about wellness programs and your well-being programs, think about how do those things not just provide a quick escape, right, to get them relaxed for the moment, but how do you arm them? How do you empower them with the skills to make behavior choices that will impact the stressors they are currently feeling today? And you can do that for everyday moments. You can also do it for some of those high-cost chronic conditions that can be improved with behavioral lifestyle changes. Very much looking forward to see that documentary that the premier doctors are working on, because it's all about that behavior change and arming them with the skills to do that. One other layer of sophistication is in this generic approach that mindfulness has right now, right? When you think about what are you practicing when you practice, we know now that it works. We've seen the evidence and the outcomes that this is an effective tool, an effective modality. But really, when you practice mindfulness, what skill are you building? What does that look like? You see a physical athlete, you know, hey, that person probably works out. What about a mental athlete? What does that mental fitness look like, and what skill are you building? What is the bicep and the tricep of mindfulness? And so what we did, which we published in January of last year, was we worked with 72 subject matter experts to validate the first ever taxonomy, the first framework of mindfulness skills to be applied for clinical use. And what that helps us achieve is precision medicine model for the mind, right? Precision medicine is all about delivering a targeted intervention that will achieve better outcomes. And so what we found was that there are 7 skills and 23 sub-skills of mindfulness. There was actually an 8th skill that they considered around relaxation, and they rejected it. Relaxation is not a skill that is developed, it's a byproduct. So I thought that was kind of an interesting thing, and I do have some of the published studies here if anybody wants to pick up a copy of it. But what this showed was that if you have anxiety or depression, you are going to have different personality deficiencies or traits that can be addressed, right? And so with depression, maybe you think, oh, this situation is enduring and it's caused by me. And in that case, you want to teach that person the skill of cognitive flexibility, because that will help them break through that rumination spiral. On the other hand, if you have anxiety, you're going to think about a situation is embarrassing or threatening is going to happen to you. And in that case, you want to teach them the skill of turning toward, because that will allow them to imagine those perceived threats without any recourse and move beyond them. So in each of those cases, you might not want to teach them focus, because if they're ruminating on a problem, you teach them to focus in on it, it's not going to help. So you really need to deliver a more targeted approach. And just like there's Hatha, Bikram, TM, meditation, the pluralism of these well-being programs is arrived, right? And this is sort of the next layer of how mindfulness and the skills around it can be applied as well. And in addition to what type of skill you're practicing, it also matters how you're going about doing it. We live in a Netflix culture, right? Everything is on demand, and that's super convenient and always the best. But we found not exactly. So we do have hundreds of hours of on-demand content, and we also do live interactive sessions every single day, about 5,000 per year. Every day there's a new topic. And what we have found is that if you practice, and this was looked at in a 30-day period, what kind of impact can be done in 30 days? On demand by itself, you can see, was the least effective of the 3. Live by itself had an improvement, where you're making that connection in a virtual world. And where we saw the biggest impact, when we looked across all the different outcomes, the ratio was roughly 30 live sessions and 6 on-demand sessions. That drove the biggest impact. And this was looking at it with roughly 8,500 people over a couple-year period during a 30-day challenge. So live with a little bit on demand is going to drive the best results. And live and virtual, I should say. But the best practice of them all is not delivered through ROI or even VOI, right? Value on investment. It's really in VIP, value in people. And we heard Dr. Murthy talk a lot about this yesterday, where it is about the connection and sense of purpose that people are missing. And what, other than through social distancing, have people been missing the most? It's that sense of connection and belonging to a greater sense of purpose. And so as we, our employer clients, they demand levels of engagement, and so we are always innovating to try and reach that. We have found something that reaches engagement and motivates people almost better than anything else. And not surprisingly, it's altruism. What we have done for people is give them an opportunity to create and celebrate their purpose, where we have this thing called vibe tribes, and anybody can create a vibe tribe based on something they care about, whether it's a world free of preventable disease, or whether it's no more plastic straws, or pets are people too. Whatever it is they care about, they can create this vibe tribe. And then they put it out there in the world, and we are social animals, right? We want to be heard, we want to be validated. And so this gives them an opportunity to celebrate that voice, and anybody who resonates with it can join that tribe. And then every tribe has a charity beneficiary. And together, every minute of mindfulness that these tribes practice are then paid forward to a donation to that charity that we make on their behalf. And so it inspires people to practice their well-being, not just for themselves, not just for the stress reduction it gives them, but they're doing it for the greater good. They're doing it for something beyond themselves. They're doing it for a purpose that they connect with and share with people on a different level. And it has amazing impact on their engagement. These are some of the vibe tribes you can see here, and how it delivers their voice is a number of different ways they share what their purpose is for the solution, and it's very helpful. I can say that we know mindfulness works. It's been very effective, certainly live with a little bit of virtual, or a lot of virtual and a little bit of on-demand help, and connection and purpose really drive engagement. But beyond this recap here, after I've listened to the great sessions through this summit, I really think that it is about this translation, right, of seeing these two epicenters of the well-being world come together, serving this shared objective, which is so clear that they both are working toward, and how we can do that over this next year. I hope we all achieve that. Thank you.